Hi, I'm Sarah Wilkerson from Infection Prevention.
And I'm Robin Addison from the Emergency Department.
And we're part of the BEST team. Today we're going to demonstrate how to don and doff PPE for a high consequence infectious disease patient. First we'll start with how to don PPE for a dry patient or someone that we're screening for a high consequence disease. The first thing you will need is a pair of impermeable boot covers. Next, a light blue extended length nitrile glove in your size, a level 4 surgical gown, a bouffant cap, a yellow face mask, dark blue extended length nitrile gloves in your size, and finally a full face shield. First step will be to remove any personal clothing or items. No personal items such as jewelry, rings, watches, cell phones, pagers, pens should be worn. Long hair should be tied up. Eyeglasses should be secured. You will want to visually inspect your PPE prior to donning to ensure that it is in serviceable condition without tears or rips, that you have all of the supplies you need, and that they are in the sizes that will fit you. Next, you will want to put on your boot covers. You may want to sit down for this step. Ensure that your boot covers are pulled up as far as possible. Next, you will perform hand hygiene. Using an alcohol-based hand sanitizer, perform hand hygiene. Allow hands to dry before moving to the next step. Put on inner gloves. Put on the first pair of gloves, light blue extended length nitrile gloves. Put on surgical gown. Ensure gown is large enough to allow unrestricted motion and that the cuffs of the inner gloves are tucked under the sleeve of the gown. You may need assistance securing the gown. Put on yellow face mask. Ensure mask fully covers the nose and mouth. Put on bouffant cap. Ensure all hair is tucked up under the cap. Put on a second pair of gloves, dark blue extended length. Ensure the gloves are pulled up over the cuff of the gown. Put on full face shield over the surgical mask to protect the eyes as well as the front and sides of the face. Verify. After completing the donning process, the integrity of the ensemble should be verified by the caregiver and PPE assistant. Inspect. Inspect the PPE for visible contamination, cuts, tears before starting to remove. If any PPE is visible, disinfect using a disinfectant wipe. Any breaches to the PPE must immediately be reported to the site manager. Disinfect and remove outer gloves. Disinfect outer gloved hands with alcohol-based hand sanitizer. Remove and discard outer gloves, taking care not to contaminate the inner gloves while removing the outer gloves. Remove outer gloves. Inspect and disinfect inner gloves. Inspect the inner gloves' outer surfaces for visible contamination, cuts, or tears. If there is no contamination, cuts, or tears on the inner gloves, disinfect with an alcohol-based hand sanitizer and do not remove. Full face shield by tilting the head slightly forward, grabbing the strap at the face shield, gently pulling the strap over the head, allowing for the face shield to fall forward. Avoid touching the front surface of the face shield and discard the shield into the appropriate waste container. Disinfect inner gloves. Remove gown. Untie or gently break fasteners. You may need someone to assist you in the removal. Avoid contact of scrubs with outer surfaces of gown during removal. Pull gown away from body, rolling inside out and only touching the inside of the gown. Discard in an appropriate waste container. Disinfect inner gloves. Disinfect gloves with alcohol-based hand sanitizer. Remove boot covers. Sitting on a new clean surface, pull off boot covers, taking care not to contaminate pant legs. Disinfect and change inner gloves. Disinfect inner gloves with alcohol, taking care not to contaminate bare hands during removal process. Perform hand hygiene. Remove bouffant cap. Tilt head slightly forward, grasp the back of the cap, pull it up and off, and place it in the designated waste container. Minimize touching the outside of the cap. Disinfect inner gloves. Remove yellow face mask. Remove the face mask by tilting the head slightly forward, grasping the elastic straps. Remove the face mask without touching the front. Discard the face mask in the designated waste container. Disinfect and remove gloves. Disinfect inner gloves. Remove and discard. Taking care not to contaminate bare hands during the removal process. Dispose of inner gloves in the designated waste container. Perform hand hygiene. Inspect. The caregiver and assistant should inspect for any contamination of the surgical scrubs. If there is contamination, shower immediately and report breaches to the site manager. The caregiver can now leave the PPE removal area and proceed directly to the shower or changing area where scrubs and shoes will be removed and proceed to shower if needed.